So my charter with the Epilepsy Foundation is to help raise awareness about epilepsy across New South Wales, and specifically to also raise awareness about the support services that are available. And there's some absolutely fantastic and exciting news, and Kris will talk more about that as well, that's happening in this space, which is just a pleasure for me to deliver. So Epilepsy Australia actually was successful in securing a $20 million federal government grant a couple of years ago, and so we're sort of into that period now, and that has been specifically to develop a lot more resources for people living with epilepsy and their families and carers, but specifically to develop that across the nation of Australia in a consistent manner. And so we're in the middle of that, and we have service delivery partners now who are involved with the foundation. So the Epilepsy Foundation, New South Wales, Victoria, have been chartered to actually coordinate and manage that whole rollout of the Epilepsy Smart Australia program. And we've actually got the launch of that in a few months' time. But the first part of it has been the National Epilepsy Support Service, which is the 1300 line, which was launched in November last year. And so we're very proud of the fact that we now have a burgeoning team of NES workers located in various parts of Australia. And of course, some of them are come from us from our service partner deliverers. So that's, for instance, Western Australia, Epilepsy Western Australia and Queensland, and the Epilepsy Centre in South Australia and Northern Territory. So we're like a coalition, and hopefully a more successful coalition than the one recently. I'm moving straight along there now. So the information line is staffed by trained support workers with expertise in how epilepsy affects health, well-being and daily living issues, incorporating a very person-centred self-management strategies. The NES trained support workers assist their clients through the development of what is called an initial needs assessment, an INAP as we refer to it. And the INAP is then used as a compass in supporting people living with epilepsy along appropriate referral pathways. And I've been heavily involved in actually developing that type of documentation as well nationally. And this is done via the provision of many, many resources, which is incredibly exciting at the moment because there's quite a lot to come, particularly peer support in the areas of not just parents, which is so important here, but also teenagers. We're looking at the adolescent area too. So there's a lot of things like that to come, and also new training modules and so forth. So available resources include information sheets. We have a whole department who are charged with developing lots and lots of information sheets on lots of different areas that affect living with epilepsy, and they are being very certified by epileptologists, very kindly giving their time. So that's all very good resources. Epilepsy management plan templates, epilepsy medication management plan templates. We help with that, the preparation of those. Best practice guidelines for people living with epilepsy, their family and or carers, and those working within disability aged care and schools. And we're also very much looking at developing resources within the workplace as well. So for employers right across Australia in raising their awareness of epilepsy and the services and supports available. So proudly, a couple of our very long-standing members at the Epilepsy Foundation. Lisa at the top there is one of our seizure and epilepsy support advisors, and we have another one here, Kira. Wave your hand. Kira's based here in New South Wales. Lisa, along with, how many have we got now, Kira? Seven. Yeah, so we're growing. And then NES, we've got about a dozen, well, maybe about 10, including around Australia. And then MARG, so that's the Epilepsy Seizure and Epilepsy Support Advisors. They provide that person-centred, individual and ongoing case management. And Erin was talking about the importance of that on leaving hospital. So that's an area that we're really developing strongly. And then Marg down the bottom is one of our RNs based in Melbourne. And so we provide evidence-based person-centred training programs. Some are online, self-paced modules through to courses delivered by our wonderful RNs specialised in epilepsy and seizure management. So hope again, a few people have had that on their slides, and I certainly wanted it included. People living with epilepsy experience better outcomes, we're told, through epilepsy knowledge, epilepsy management planning, through seizure first aid response and training in emergency medication administration. So I have some resources here today, and I think a few people have already had some of them, but we're starting to do more sort of information now that we're handing out into the waiting rooms of neurology practices throughout New South Wales. That will develop hopefully right around the country, and also in the hospitals. So that's hopefully of interest. If anybody wants any of those, please come and see me afterwards. We're also trialling a little referral notepad for neurologists to see whether they find that helpful to actually just rip one of those off and fill it out and give it to their patients, so that they know where to come for help with us. So that's it from me, I think, and over to Kris. Thank you. Thank you.
Thanks, Cheryl. Right. Just checking which hat I've got on. So, so I guess just to follow on before I go into my slides, that the important thing for me, and I guess for families with DEs, is that the Epilepsy Foundation have recognised that that was a gap in their services, and that we are trying to rectify that. And Kate sent me an email a little while ago saying, Kate, who spoke yesterday, saying that since I've started, she feels and her community feels more connected to the Epilepsy Foundation. So I think that's a really good reflection that the work that we're all doing is starting to shift that dial a little bit. And importantly, like what Cheryl was talking about, the NES information line, but also epilepsy support workers and all the resources is now getting the lens of DE across it, so that we're making sure that any resources and services that we develop are also tailored as much as they can to our families and also those that support us. So how do I down? Yep. Okay. So just to recap a little bit sort of how we've got here. So back in 2019, we were just pre-pandemic. We had a meeting in Melbourne where we had a really wide array of stakeholders, including families, geneticists, neurologists, other clinicians, epilepsy nurses. The Epilepsy Foundation were there. GETA had some representation, and we sat around and talked about what the issues were for families with DEs, and that has provided us with a little bit of a map of what the gaps were, also supported by the research that all our amazing researchers are doing. Epilepsy Foundation also did a very big gap analysis, and one of the things that came out of that was the vulnerable families their needs are not being met, and that's across diversity, inclusion, but also our families with DEs who are vulnerable in terms of just getting the support they need to stay afloat some days. And that has led to the appointment of myself at the Epilepsy Foundation. That's really a lot of the advocacy from the GETA team and also the broader GETA community in saying we need more from you. And so I'm really grateful to be able to, I guess, stand up and do some of that work on behalf of our families. And then the other piece that we've been doing this year, or actually it was last year with Catherine Howe in Melbourne, is we have conducted a DE survey looking at the impact of having a child with DE, but also the impact on the child. So that will also feed into next steps and also help us with a lot of our advocacy work in changing some of the trajectory for our families. So the key things that came out of the roundtable, which I guess would not surprise any of you, is coordination of care, provision of specific information, caregiver fatigue, and clinical care pathways. And so we've heard some people touch on those across the last 2 days, and there's some really forward movement and some really good outcomes coming in some of those spaces. So with coordination of care, what are we doing at the Epilepsy Foundation to try and support better coordination? And you've just heard from Cheryl, through the National Epilepsy Support Service, we're looking at how, when a family with a DE comes in, what does that look like? What are the steps? What's the information? Can we link them into Gene Compass if they're in New South Wales? All those sort of things. We're really trying to bring all of that together. And it's the same with epilepsy support workers. We now have a process at the Epilepsy Foundation. It's just really commenced in the last sort of month. When a new support worker comes on, I'm having a one-on-one with them, telling them work that I'm doing, explaining what the different needs are of our families compared to others with epilepsy. And then the other piece I just touched on earlier when Erin was talking is that this is just one piece of work and there's lots happening, but I just want to touch on this, is that our families or our kids, we are sent home with emergency life-saving medications to keep our kids alive. However, I've not heard of one family that is then surrounded with any supports, either counselling for the parent, any supports in terms of the fact that you are now your child's, emergency care doctor, that we have talked about. So we've been involved in the Paediatric Palliative Care Action Plan, and complex epilepsy syndromes is how we've named it, is now embedded into that action plan in terms of being recognised as a condition that needs palliative care. What is palliative care? It means different things to different people. But I think for our families, it is that we are looking after children with a life-threatening condition, whether it's sometimes that unfortunately is life-ending. And so we need to make sure that our families are getting that care and support that they need, and we need to be doing it much earlier. It may be a service that we move in and out of as we need it, and I think that needs to be dictated a lot by the family. So I'm really appreciative of that. We've actually we did a little roundtable with some families on what their experiences have been and what they would like to see in the palliative care space for DE families. And we've submitted an abstract, and hopefully that will be accepted, and we'll present that at the palliative care conference in October. We should hear soon about that. So what are we doing at the Epilepsy Foundation in terms of resources? I'm a very big believer in not reinventing the wheel. But we are a different channel in which to get out to families. A lot of the work we do is in conjunction with GETR, and it's a partnership, but my role at the Epilepsy Foundation isn't GETR. So we're about to launch a newsletter where we'll be giving updates on researchers, conferences, family stories, what we're doing in advocacy, and those sort of things. That will start next month. We've started, at the minute, it's a quarterly webinar. The topics will change. If you've got requests, let me know, shoot me an email. But we've done NDIS. We've recently just done support for families, like what is it? How do we, like what Ursula's talking about, how do we as parents adapt to the expectations of having a different family than what we've currently got. And as Cheryl mentioned, we're doing a lot of development of web pages and downloadables, so that hopefully that will help support you. You can come into our website and navigate and just download some information that will be evidence-based, written by medical people in a layman's terms for you to use. We can't do gene-specific. It's just too hard. We don't have the resources as Gene Compass team have been finding. But there's a lot of information. I think from my experience raising a child with a DEE, I didn't realise the breadth of resources that are available for us that we can utilise in terms of working with the school, getting education, getting training. So there's a real whole host of things that I implore you to have a when you've got that 10 minutes, we'll take it back for a bit and just go have a look, and I think you'll find some things that are really helpful. And then I guess the other thing that we're doing is participating as Epilepsy Foundation in projects like Gene Compass to just make sure that lived experience is embedded across all these amazing projects that are happening. So one of the big things that I want to work on, in fact, it's my job when we finish GETA, is to work on care pathways for DE patients, and that will be through the Epilepsy Foundation. But as of last night, when the election was conceded or announced with the new Prime Minister, we actually now have funding for a care pathway nurse for DE patients. So that, I'm not sure how long the fund, I think it's 3 years actually, but it's just a part-time role that will help us develop this pathway for DE patients. So when I was up last night, couldn't sleep, I was like, oh yeah, we've got So yeah, that was a pre-election promise that we will start to work through with the national program, the Australian Patient Organisation Group, which is APON, and they've got a number of different pathway nurses that they've been working with, and this will just be another one that we embed and work with them on. And then I guess the other piece at the Epilepsy Foundation is being a collaborative partner in research. And anyone that knows me knows I am very passionate about having the lived experience embedded in all we do, and the classic saying of nothing about us without us. So we're very, at the Epilepsy Foundation, we're very committed to consumer engagement and are working on a broader consumer engagement, and the DE space is being used as a pilot for the greater Epilepsy Foundation engagement framework. And that's because we've set up a consumer advisory group already, which is made up of varied DE parents, and we're using that as a very bilateral approach to developing resources and services, and making sure that what we're doing is in line with what families need and want. We're also co-investigators on some research projects, which is around a whole range of different things, whether it's resources, whether it's how do we diagnose more people with DEs. So we're really grateful for those opportunities to partner with research teams, both nationally and internationally. And so what can we do? This is also a real passion area of mine, is making sure our caregivers are cared for as well. And we've been working with a group in the US that I've met through my international work in rare disease called Angel Aid, and they do a lot of work in caregiver, filling the bucket of the caregiver. So we're actually running a pilot project that we've got funding for, which we'll be launching in August. It's going to be a virtual retreat for caregivers in the DE space. It's going to be a pilot program, so we're going to measure it so we can evaluate it and then hopefully get sustainable funding for that ongoing. And as Cheryl mentioned, peer support networks. So the Epilepsy Foundation is working on a really broad peer support project, and when that gets to a certain point, we're going to bring in and make sure that we have a DE support group that's related specifically for DE families. And then some of the other things we're looking at is what can we do to support siblings? It's really important. We're having conversations with Siblings Australia. And then also, and Kate's not here, but the other day we got told that we were successful in getting a large grant to run a family day for DE families, which will be later in this year, and it's going to be a fun day with entertainment, and it's going to be for the whole family. So we're trying to bring a bit of joy into your world, and yeah, we're looking forward to that. So Kelly Cloissy is going to be leading that charge. So I just want to say thank you, and I've just been a great couple of days, and I really appreciate everyone's support and just collaborative approach to working and improving outcomes for our families. So thank you.